All right, so if everyone can right now just mute your lines just by pressing *6, we'll have time to ask questions at the end of the webinar, and so during that time you can unmute. So please just go ahead and do that, and then hopefully you'll still be able to hear me. I'm not sure what happens there. Sorry. All right. So I wanted to just let you know that we're really excited about this national webinar, which is part of AMCHIP's ongoing work on the National Consensus Framework for Improving Quality Systems of Care for Children and Youth with Special Healthcare Needs. This series is hosted in partnership with the National Academy of State Health Policy, or NASHP, and with support from the Lucille Packard Foundation for Children's Health. The overall goal of the National Consensus Framework for Improving Quality Systems of Care for Children and Youth with Special Healthcare Needs project has been to reach consensus among key national stakeholders on the desired capacity and performance of systems of care serving children and youth with special healthcare needs, and to use this set of national standards to help state leaders transform and improve systems of care for children and youth with special healthcare needs and their families. Throughout the development and dissemination of the national standards in phases 1 through 3 of this project, members of the project's national work group have recommended identification of existing data and quality measures that align with the national standards. Members of the work group stress the importance of measures for states to better implement and measure the impact of the national standards within their system of care. Additionally, there is a need to continue to promote use of the national standards among a variety of key stakeholders, including state Medicaid agencies, state Title V Children and Youth with Special Healthcare Needs programs, children's hospitals, health plans, provider groups, families of children and youth with special healthcare needs, and others. As part of this call to action, AMCHIP, in partnership with NASHP, has developed a summary of selected contract language in up to 3 selected domain areas of the national standards from 4 state Medicaid agency contracts with managed care organizations, which is what brings us all here today. This tool that we call our Medicaid Managed Care Contracting Language Tool was developed to be readily used by states interested in the role for contracting for improving systems of care for children and youth with special health care needs, use and application of the national standards for children and youth with special health care needs, and examples of sample contract language in core domain areas of the national standards and for children and youth with special health care needs. So before we jump into our presentations, I wanted to alert you all to the file pod that's in the top right corner of your screen. In the file pod, you'll actually find the National Standards 2.0 PDF version. You'll also find the actual Medicaid Managed Care tool that we'll be talking about today. And then finally, there are the slides from today as well. We'll be sending all of these things around after the webinar, but we wanted to make sure you all had access to the interactive PDFs of these two, and we'll also send around our online links for these resources as well. All right, so as you can see, we have a really great agenda for today's webinar that includes presentations from our partners at NASHP and presentations from 2 Title V Children and Youth with Special Health Care Need directors. We will have ample time for questions and answers at the end of the panel presentation. But during the presentations, if you do have any questions, feel free to just go ahead and type them into the chat box, and we'll be sure they get answered after our presenters are finished. Just to smooth the process today, let's just hold all of our questions until the end. All right, so joining us today, like I said, is a dynamic panel of presenters. I'm going to quickly introduce each of them now, and then we'll dive into the presentation. So our first presenter will be Karen Van Landeham, who is the Senior Program Director at the National Academy for State Health Policy. We also have Rachel Jew, who is the Title V SHCN Director in Texas, and then Susan Chacon, who is also the Title V SHCN Director, but in New Mexico. So first, I will turn it over to our first presenter, Karen Van Landeham, who, as I said, is from NASHP, where she leads the organization's work on child and family health, as well as the portfolio on children and youth with special health care needs. You can take it away, Karen.
Thanks, Paige. Good afternoon, everyone, or good morning, depending on where you are joining us from today. Again, as Paige mentioned, I'm Karen Van Landeham. I'm a Senior Program Director at NASHB and delighted to be part of this national webinar. I just also want to add my thanks first to AMCHIP for the partnership that we've had in terms of this work on the national standards and also these related tools. And then also want to just thank also the Lucille Packard Foundation for Children's Health and Ed Shore in particular for their longstanding leadership and investment in the national standards and, again, the related tools. So today, I'm going to quickly, in 10 minutes, 10 or 15 minutes, do some level setting before Rachel and Susan really talk about this work and how it applies in their states and some of the leading work they're doing. I'm going to provide a very brief overview of the national landscape on children and youth with special health care needs in Medicaid managed care. I'm going to talk about some state opportunities and levers, and then I'm going to highlight some core elements of the Serving Kids with Special Health Care Needs in Medicaid managed care contract tool. And just to say that I think the topic of Medicaid managed care is one in which we could talk about for an entire day, at least way more than 15 minutes. So a lot of what I'm covering is very broad brushstrokes. I'm going to cover some of the findings that we recently, excuse me, I'm sorry for my voice, we recently released, and then talk about some potential strategies that states can be thinking about. At the end of my presentation, I have a list of resources, including additional information about Medicaid managed care, because I recognize that maybe not all of you who are joining this call may be as familiar with Medicaid managed care and you may want some more information. So with that, I will get started. As Paige mentioned, this work is part of a broader project that I shorten and call the National Standards for Systems of Care for Children and Youth with Special Health Care Needs. If you're not familiar with this resource, I strongly recommend that you review it. On this current slide right now, on the left-hand part of the slide is the version 1.0 that was released in 2014, and then AMCHIP and NASHB, again with support from the Lucille Packard Foundation for Children's Health, recently updated and more just kind of streamline the standards, and that's what you see on the right side of your screen. And again, the link is here in case you haven't read those standards. And really, just to underscore what Paige mentioned in the beginning, is that the national standards were developed to really kind of put in one place work from many across the country and in states, and really a consensus around what needs to be in place in terms of a comprehensive system of care for children and youth with special health care needs and their families. So why Medicaid managed care? Why is it something that's important to be thinking, looking at? NASHB this past summer, with the support from another important partner, the Maternal and Child Health Bureau, Health Resources and Services Administration, we conducted a 50-state review of every state Medicaid managed care contract. We were interested in really understanding, at least this first go-around, and we're doing more follow-up work, but we were really interested in kind of some basic questions. First, which states are actually shifting their Medicaid beneficiaries into Medicaid managed care systems? If they do have a Medicaid managed care system, are they enrolling children and youth with special health care needs in that system? And then if they are, which populations of kids with special health care needs are being enrolled, and what is the breakdown of that? So just to briefly highlight some findings, and at the bottom of this slide you can see the source, and that's the link to the longer issue brief and also the 50-state map, and also a 50-state table that I think provides much more information than I'm going to be able to cover today, but I think is an important resource if you're interested in more information about this. But one of our really big findings, and I'll back up a little bit and just say that we at NASHB intentionally decided to take a broad view of Medicaid managed care, in that we looked at all types of Medicaid managed care. Oftentimes when, especially when you talk with state Medicaid agency officials, and others, many states often think about risk-based managed care, which is That's whereby, in this case, the state Medicaid agency would pay a health plan a per member per month fee to provide services to their members. We included that, but we also did a broader look and looked at other types of managed care, including primary care case management and prepaid health plans. And if you want to know what those are, that's in the issue brief, so there's a definition of those in that issue brief. But in short, what we found is that 47 states have some form of Medicaid managed care that they're now implementing. If you look just at risk-based Medicaid managed care, so again, that's where health plans get a per member per month fee and the state contracts with health plan to deliver those healthcare services, it's still pretty high. 37 states rely exclusively on risk-based Medicaid managed care. And of those states, all enroll some or all populations of their kids with special health care needs into Medicaid managed care. So this is a really significant finding. It's a big trend. For many of you, if you've been in the field for a while, you know that, a couple decades ago or even in the early 2000s that there was tended to be kids with special health care needs were carved out into a separate system that were typically paid for through Medicaid. Again, I'm talking about Medicaid through fee-for-service systems, but we're really seeing a big trend where state Medicaid agencies are shifting not only children but adult populations into Medicaid managed care. And the goals are really threefold. There's a real interest in trying to improve and streamline care and improve the quality of care. There's an interest in trying to improve consumer satisfaction and then also to reduce healthcare costs. So this is among some of the other findings, and again, I'll encourage you to look at this issue brief if you haven't, but one that I just wanted to note for this particular webinar that I think is important is that in addition to all states enrolling some or all populations of kids with special health care needs into Medicaid managed care, of those states that have Medicaid managed care, there were some populations that we saw for whom enrollment was most common. Children in the Medicaid ABD is the aged, blind, and disabled category. That's a specific category within Medicaid. Children with a chronic condition and also who are eligible for Medicaid due to their income. And then also children enrolled in Medicaid as a result of foster care placement or adoption assistance. So again, when we looked at all 50 states and looked at their Medicaid managed care contracts, these were the populations of kids with special health care needs that really rose to the top in terms of being most commonly enrolled in Medicaid managed care. That was also followed by other groups, including children who are in the Supplemental Security Income Program, or SSI. And then about 1/3 of states, or 14, enroll children with home and community-based services waivers. One of the other things we looked at is whether or not states were developing specialized plans for children and youth with special health care needs, or did they enroll kids with special health care needs into standard health plans? In other words, health plans that serve both adults and children, child Medicaid beneficiaries. And so what we found is that the majority of states with Medicaid care enroll kids with special health care needs into standard health plans. In other words, those are health plans, again, that serve both adults and children. There were 6 states in the District of Columbia, and those are the states there on the slide, that have developed a specialized health care plan to serve either all or some Medicaid-enrolled populations of kids with special health care needs. And then by way of example, those are some of the states. So Texas, and many of you may be familiar with Texas. It's been getting a lot of, lots of folks have been writing about Texas because of their Texas Star Kids program. So they serve kids with special health care needs in SSI or with a Medicaid disability waiver. Virginia, it just recently launched in August 2017 its Commonwealth Coordinated Care Plus program, which serves adults and children with chronic and complex health care needs. And then DC, the District of Columbia, by way of example, uses a single managed care organization to serve kids with special health care needs, and it's at an option for families to enroll in that plan. So that was a very quick, brief overview of kind of some of the findings with regard to the work we did, again, I encourage you to look at the issue brief, and then NASHB will be having additional releases of additional information. We plan to do an issue brief, and it's going to be released really soon, that does a more in-depth look at 7 states and also an in-depth look at 7 states with their care coordination program. So if you aren't part of our NASHB newsletter, I encourage you to go to our website and you can get those materials. So just shifting from kind of those high-level findings, I think the takeaway from the findings is that Medicaid managed care is really important. It's definitely a trend nationally we're seeing, and we, from what we're hearing from state Medicaid agencies and other state officials and others in states, it's going to continue to be a trend. So there's many opportunities and levers with what we call at NASHB policy levers within Medicaid managed care to really try to partner with state Medicaid agencies and others in how to ensure that the system really serves the unique needs of kids with special health care needs and their families. So at the most basic level, I encourage you to, if you're not working closely with your state Medicaid agency, that you, approach them, especially if they kind of 5 folks on the call, to really talk about partnering with your counterparts in state Medicaid in both not only the design, but also the implementation and the reprocurement, meaning states have to update their health plans and their contracts with health plans regularly. Many of you are probably aware also that the feds recently released federal Medicaid managed care regulations this past spring that provide real specifics to any state with a state Medicaid managed care program about different regulations that need to be met. And within those Medicaid managed care regulations, there are some important opportunities for children and youth with special health care needs, including things around network adequacy and identification of kids with special health care needs when they enroll into a health plan. And on this slide, there's not time to go into that during this presentation, but that's a hyperlink to the federal Medicaid managed care regulations. And we also at NASHB have resources about that if you want more information. And another important opportunity to really help shape Medicaid managed care contracts and the contracting process is just everything that happens with regard to enrollment. So states have many choices in terms of how they approach designing their Medicaid managed care program, including decisions about which subgroups of kids with special health care needs to enroll, whether that enrollment is mandatory or voluntary. We found that most, as I said, most states are mandatorily enrolling kids with special health care needs into Medicaid managed care, but many are doing it in a phased-in way because they want to make sure that families are familiar with the system and they have continuity of care. Another decision that states make is whether or not to develop a standard or specialized health care plan, and then will enrollment of kids with special health care needs be phased in over time. Other decisions with regard to the Medicaid managed care design include how enrollees are assessed and identified, things around assuring network adequacy and continuity of care. Again, that's in the Medicaid managed care rule. What will care coordination look like within the Medicaid managed care plan? And things like transitioning children and youth with special health care needs from child serving systems to adult serving systems. And this is a short list. This isn't all, but those are just some of the key ones. States are also very active in developing performance incentives for health plans and providers, so that's another important opportunity. They're also looking at how to engage stakeholders in the design and implementation. Texas is a good example that did a very thorough and extended process in terms of rolling out Star Kids, and so you can find that on the NASHB website as well. And then finally, measuring quality is another important opportunity. Again, we're not able to get into that all today, but another important policy lever. So I want to make sure there's enough time for Rachel and Susan to talk. I'll just wrap up by just quickly talking about the tool. It's was developed in partnership with AMCHIP. We selected contracting language from 4 states with leading efforts in Medicaid managed care. These aren't the only states, but these are the ones that were picked for this tool. And then we include contracting language in 4 areas aligned with the national standards. One thing just to underscore, for those of you, you may already know this, but contracting language is just a guide. Every state is unique, and so I would just encourage, as you look at the tool, to just keep that in mind. It's not that, you know, language from Texas can be plopped into another state, but we hope that it's a guide and useful as you think about the language for your own contracts. This is just a list of selected resources, and that last bullet is just one if you want to know more about Medicaid managed care and definitions and key terms. That's a really great issue brief that was done by the Kaiser Family Foundation. So with that, I'm going to turn it back to Paige.
All right, thank you so much, Karen. That was very informative and a really great overview for what we're going to talk about further with our Title V representatives. So just as a reminder, we will hold questions until the end of the panel presentations, so please feel free to just chat your questions in at any time using the chat box at the lower right hand of your screen. So now I'd like to introduce our next presenter, Rachel Jew, who's the Title V SHCN Director in Texas.
Thanks, Paige, and just a thank you to AMCHIP and NASHB for the opportunity to spend a few minutes today sharing how the Texas Title V program has been partnering with the Texas Medicaid program to establish the Star Kids Medicaid Managed Care Program for children with disabilities. So just before I get started, I just wanted to provide some background to give you a sense of our organizational structure. In 2015, the Texas Health and Human Services System began a reorganization, and that was kind of rolled out in 2 phases, first in September 2016, and then most recently September of this year. So essentially now this is what the Health and Human Services System in Texas looks like. We went from a 5-agency system to now just a 2-agency system, and all of our direct services moved over to the Health and Human Services Commission, and the Department of State Health Services, where the Title V program lies, is focused solely on public health services and carrying out those core public health functions. So you can see that our Medicaid program is with the Health and Human Services System. And then I also wanted to point out that in Texas, the Health and Human Services System also administers a small, separately run healthcare benefits program for children with chronic physical disabilities. That's the CYSHCN Healthcare Benefits Program, and that's where our Title V dollars for direct services for children with special healthcare needs go. So it's important just to mention that the changes that we'll talk about today regarding managed care did not affect the CYSHCN Healthcare Benefits population. That program is still run under a fee-for-service basis. So today I'm just going to talk about the partnership that we had with Medicaid, and I just highlighted those boxes in red. So our state legislature meets every other year, and during the 2013 regular session, Senate Bill 7 was passed, and that directed the Health and Human Services System to establish a capitated managed care program that was called Star Kids, to provide Medicaid benefits to children and young adults with disabilities. So under the Star Kids model, there are 13 service areas in our state and 10 managed care organizations. Within each service area, these Star Kids members have a choice of 2 managed care organizations. Every member is assessed using a tool called the Star Kids Screening and Assessment Instrument, or the SAI. That was designed by the Texas A&M University to help the MCOs, managed care organizations, and providers really to better understand the members' needs and preferences. Every member also has an individual service plan that documents those needs and goals, and the ISP is shared with the family, other case managers if the child has any, and providers. Every member also has access to service coordination, and members can always ask for more or less service coordination depending on their needs. So that rollout occurred just over a year ago on November 1st, 2016. So since 2013, we have been working closely, the Title V program has been working closely with our Medicaid partners to plan for this new program. An advisory committee was formed early on in the process, and they continue to meet on a quarterly basis, and we have had the opportunity to give presentations to the advisory council, advisory committee, including presentations about the national standards of care for children with special health care needs. And we attend every meeting as well. We also have current and former Title V contractors on the advisory committee, so that's really great to see their leadership continuing through that advisory committee. We also had the opportunity to provide a lot of input on the transition requirements for the MCO contracts. So each child has a service coordinator and a transition specialist, and usually around age 15, those two service coordinator and transition specialists work closely together in that area. We have given a presentation to one of the MCOs, the STAR Kids MCOs, to their service coordinators and transition specialists about transition. And then our Family Voices organization also has a partnership with the Health and Human Services Commission to give presentations to all of the MCOs in the STAR Kids network. And then although we don't serve on the advisory committee, we definitely maintain open lines of communication with the Texas Medicaid staff and share what we're hearing from parents and providers. So the work continues, but we're really happy to be recognized as a partner in building and strengthening this model, and certainly encourage any other Title V programs interested in hearing more to reach out to us. And with that, I will pass it back to Paige.
Great. Thanks so much, Rachel. It's really wonderful to hear about the work you're doing in Texas. And, as Karen mentioned, every state is different, but it's always helpful to hear from examples. And, states who maybe haven't prioritized this can really think about how to take the next steps towards this. So thank you so much. That was really great. So now we will pass it over to Susan Chacon, who is the Title V SHCN Director in New Mexico.
Hi, everybody. Can you hear me okay? Not sure if I'm on mute.
Yes, we can hear you, Susan.
Okay. Well, again, I'd like to thank AMCHIP and NASHB for allowing me the opportunity to present on what's going on in New Mexico regarding managed care. So currently, Centennial Care is the name of our New Mexico Medicaid program, and it was created through a 1115 demonstration waiver, and that was approved for 5 years. It began on January 1st, 2014, and it really kind of revolutionized managed care in New Mexico. We have 4 managed care organizations that are contracted to provide services, and part of the waiver was to integrate physical health, behavioral health, long-term care, and community benefits. And then we had ACA, and we are a Medicaid expansion state. All Medicaid beneficiaries must enroll in an MCO, so that includes children and youth with special health care needs. The only exception is Native Americans who are exempt and remain fee-for-service. Right now, we're actively in the renewal phase of our waiver, so we're going through public input, and so it's a perfect opportunity for us to be working with our Medicaid partners. So I just wanted to highlight a couple of areas in the current contracts with the MCOs, And the first area is around identification. And this is what's currently in the contract. The MCOs are required to conduct a health risk assessment on every member that's enrolled, and then they're tiered as a level 1, 2, or 3. And if they're a level 2 or 3, the next step is a comprehensive needs assessment. And I think this is an area where it's a little more global in terms of the definitions, and it's an area that we're hoping to have a little bit of input as we're going through this public input phase with our renewal process. But the MCOs, there's not like a specific definition for children and youth with special health care needs, and seem to have a little bit of latitude in terms of how they are defining certain populations. So all members are assigned a care coordinator, but the type of interaction is dependent on their level. So if a member is screened as a level 1, that's the least amount of interaction. And it may mean an annual call, but it does mean monitoring by the MCO care coordination unit. For level 2 and level 3, they have a little more interaction with their care coordinator, and this is just a description of some of the functions that are listed. And just to let you know, the care coordinators that the MCOs hire are from various backgrounds and various education levels. Some of them have a behavioral health focus, which has been really positive. But we spent a considerable amount of effort as a Title V program talking to them about children with special health care and the type of expertise that you need to have in terms of providing care coordination. And through a lot of meetings and hard work, we've actually developed some really good relationship with the MCOs and have a good partnership, and I'll talk a little bit more about that in a couple minutes. The other area I wanted to highlight was around network adequacy, and this again is in the contract. And of course, this is very challenging, and many of you that come from very rural frontier states, you know that it's access to care is a huge issue. We have a lot of provider shortages. In New Mexico, all the pediatric specialists are in Albuquerque, which is the central part of the state. So it makes it very challenging for families that live in areas that take them 4 to 5 hours to drive in to see a specialist. So our Title V program is seen as the infrastructure in the state for children with special needs through our outreach clinics. And I'm going to talk to you a little bit more about the contracts that we have with the MCOs, but this was, to have this in the contracts it's been really helpful in terms of getting prior authorizations and really trying to help families access specialty care when they live outside the metro area. So I pulled this from the actual contract that the Department of Health has with each MCO. And as you can see, we are able to provide care coordination and receive a capitated fee of a per client per month of $250 for the services that we provide. The other item is around the specialty care clinics. And again, we bill CPT codes for the doctor visits, so all that revenue kind of flows back into our program. And again, just this language kind of helps us get through the red tape because some of the MCOs have had some trouble negotiating conflict with the university hospital in Albuquerque that provides a pediatric specialist. So sometimes kids have to go out of state to receive specialty care, but with our clinics, at least they can have access to a specialist within the state. So right now, as I said, we are in the process of the renewal of our 1115 waiver, and these are some of the changes that we're monitoring. The concept paper has been completed, and now we're in the public input phase. So some of the proposed changes include care coordination at the provider level, leveraging partnerships to target high-needs populations, improve transitions of care, institute copays and premiums, and eliminate the 3-month retroactive eligibility period. So this is one of the areas we're kind of keeping an eye on, and it is a proposal for a delegated model of care coordination. And what this is proposing is that the MCOs could actually work with community agencies, as you see listed there, and reimburse them for care coordination activities. In the concept paper, Medicaid is trying to increase member participation in patient-centered medical homes. And just to read you something directly from the concept paper, Centennial Care 2.0 seeks to expand on this initiative by continuing to transition care coordination functions from the MCOs to the provider level, known as a delegated model. And I think this model is something that we need to be learning more about and understand how it might affect our program. The other issue, which is good news, is in the proposed contract for the MCOs, is this provision that they must make good faith efforts to contract with the state teaching hospital for all services provided. So this actually could improve access to specialty care for the children in our state. So we'll be watching that. And in terms of Title V involvement, we have a work group that has been going through the concept paper and providing public input and comments on these areas: care coordination, transition, and provider network. We currently have an initiative that we are working with the 4 MCOs, Medicaid, our F2F, and our improvement partnership program, Envision New Mexico, at the University of New Mexico, to work on a definition of children and youth with special health care needs, best practice for transition of care, and a better definition of specialized care coordination. So some of the things we're hoping to do is actually provide examples, like from the contracting tool, successful examples from other states. We're realizing if we can't affect the actual contracts, that another way to make some changes is possibly through the policy manual that all MCOs are required to have, and or we could ask Medicaid for a letter of direction to the MCOs regarding identified issues. And that is a process that Medicaid uses to direct the MCOs to implement changes or whatever needs to be done. So in conclusion, we need to continue to monitor the waiver renewal process and subsequent contracting. It's possible that new MCOs might be awarded, so we need to make sure we develop relationships with the MCOs that are awarded the contracts and continue to leverage our partnerships with Medicaid to provide direction to the MCOs. Thank you very much.
Wonderful. Thanks so much, Susan. And just another thank you to all of our speakers today. We really appreciate you taking the time to share your experiences and your lessons learned with those of us on the webinar today. So before we turn it over to questions, I wanted to just quickly show you all what the tool looks like and how we intend for it to be used. So give me 1 second. And please know that you can download it in the file box as well. But just a quick overview. So in the beginning, it's sort of an environmental scan and a really great high-level overview of how the tool was developed and really summarizes the key findings. So I know Karen went into this a little bit in detail earlier on, but I think it's a really great overview for you all and important to go through. And then show you really quick, so there's little boxes for each state explaining how each state's Medicaid managed care is set up. So feel free to read through those, and it is hyperlinked. You can go to the actual websites for these managed care organizations to find out more details. And then finally, I wanted to show you all that basically each state example is in its own appendix, and it's organized by the national standard that the Medicaid managed care language is related to. So just for an example, if you scroll down, Texas is first, it just lists that whatever the national standard is, and then below is the Medicaid managed care contract language that the group found to be related to that specific national standard. So just a quick overview so you all know how to sort of navigate the document. It is hyperlinked throughout, so it's meant to be an interactive PDF for you guys. And I did just want to say something really quick to let you know sort of what we're doing now. So phase 3 has actually ended for the National Standards larger project, but we have begun phase 4, and this phase is actually being led by NASHP, still in partnership and support from the Lucille Packard Foundation for Children's Health. So we're actually leading a learning collaborative titled Strengthening Medicaid Managed Care for Children with Chronic and Complex Healthcare Needs. And we have 7 states in this learning collaborative, and we're really excited for them to dive into this a little bit deeper. So we just kicked it off about a month ago at NASHP's annual conference, and we're really looking forward to getting into more. It's a year-long learning collaborative, so look out for more resources from us, and we'll definitely, like any learning collaborative, be willing to share sort of what are the results of this, what did states learn, things like that. So just wanted to alert you all to that. So now we have about a little less than 15 minutes for some questions. So feel free. It looks like we've had a few questions pop up in the chat box, but I think all of those have been answered so far. So at this time, feel free to, let me just pull up our slides again, y'all, sorry. So you can either type your question into the chat box, or you can just unmute your line by pressing *6, and that will, you can just ask a question, and then we'll direct, if you have it directed toward a specific presenter, let us know. If not, we can just, see who wants to answer the question. So while I wait for you guys to think, we'll just do a quick overview of what folks have already typed into the chat box. So we had a question about what definition of children with special health care needs was used in the interviews. And below, it states that NASHP used the federal MCHB HRSA definition of SHIN, but also reviewed definitions for all 50 states. And the state Medicaid managed care enrollment and design for children with special health care needs issue brief also includes findings on which states actually specify the definition in their Medicaid managed care contracts. So those are all resources that were at the end of Karen Van Landehem's presentation, and those slides are available in the file box, and those are all live hyperlinks. So please feel free to navigate those for your questions. We also had some questions about do we anticipate Title V having input into quality measures for delegated care coordination? And really, folks are saying that, we hope that Title V can have some input in the future. So others, feel free to jump in. Like we just got a question, what's the CPT code for care coordination reimbursement? So if anyone wants to answer that, that'd be great. One of our speakers.
Hi, this is Susan, and the code we use is the T1017, but I'm not sure if that we have a negotiated rate with the managed care organizations, so I'm not sure if that is the one that we use. So we've negotiated the rate for that. Instead of a fee for service, we have a flat rate. So I can type that in for you.
Great, thanks, Susan.
And I'll just say, this is Karen. I think, so that's great to hear what Susan's using, and I think every state likely reimburses a little bit differently for care coordination. So I know the Catalyst Center and Meg's on this webinar, so she's been sending us some questions. They did an issue brief with support from the Foundation on kind of financing of care coordination, and she may want to jump in and speak more to that. And then We are also going to be releasing as kind of a follow-up to our national 50-state review. I mentioned it in my presentation, but an issue brief on how 7 states are financing care coordination. We didn't look at CPT codes, but there might be information useful to you all in that issue brief, and we expect that to be out by January.
Great, thanks, Karen. And I just realized that there was another question that was asked, and this was about the risk assessment tool that Rachel talked about. And so if you all have any other questions about that, feel free to reach out to Rachel directly. She listed her contact information in the chat box, and it's also in the slides in a few places. Looks like we got another question. Can you summarize what the 50 states Medicaid children youth with special health care needs definitions are?
Yeah, sure. So this is Karen again. Just by way of a little bit of background, and everyone on the phone may already be aware of this, but just, and I mentioned it again in my presentation, but just to expand a bit, the new federal Medicaid managed care regulations that were released this spring, require states with managed care systems that they set up a mechanism for the state or the managed care plan to identify enrollees with special health care needs. So that's adults and children. So as part of our 50-state review, we were really interested in understanding whether or not states include a definition of kids with special health care needs in their Medicaid managed care contracts, and if they do, what are those definitions? And what we found is that nearly half of states define kids with special health care needs in their Medicaid managed care contracts. And the definitions really ranged. They ranged from direct alignment with the federal definition by the Maternal and Child Health Bureau, HRSA, that was in 10 states, to definitions that relied just specifically on condition-specific diagnoses and Medicaid enrollment categories. And in the issue brief that was in my presentation and at the end, this 50-state review, you can find more in there. We actually included just some sample definitions from several states across the country just to give a sense of kind of the range of definitions and some of the ones that we thought were rather interesting. So you can go to that issue brief for those definitions. Hope that answers the question.
Wonderful. Thanks so much, Karen. And for those of you who may not be connected to the Adobe room, feel free to email Meg Camo from the Catalyst Center, and I'll be sure, since there's been so many great questions that have been asked in the chat box, when we follow up after the webinar, we'll be sure to send around these extra contacts that we've gotten. Specifically, the Catalyst Center, if you want a PDF of the care coordination conundrum, which is what Karen had mentioned previously, and then also Meg just mentioned the preview of coming attractions, is that the Catalyst Center is working on a primer regarding the new Medicaid CHIP managed care regulations that are translated for Title V with recommendations for partnering with Medicaid and MCOs to better serve children youth with special health care needs. So thanks so much, Meg. We really appreciate that. That sounds like really exciting work, so looking forward to seeing that. All right, so any other questions that folks may have, feel free to just unmute your line or type into the chat box.
Paige, while folks are thinking about other questions, this is Karen. If I could just do a quick commercial, because Susan brought this up in her slides as in terms of what New Mexico is thinking about, and we know a lot, and I know Rachel and Texas is doing this as well, and a lot of states are really interested in this, and I'm going to ask Anisha from our team to jump in, but NASHB has a national webinar that we're going to be conducting in a couple weeks with support from the Lucille Packard Foundation for Children's Health. It's going to be focused on Medicaid quality metrics for kids with special health care needs. So how are states thinking about use of Medicaid quality metrics in Medicaid managed care, but also more globally. Rita Mangione-Smith, many of you may be aware of Rita's work, will be part of that, and then we're going to feature the work of New York. And Anisha, can you please jump in and just tell folks when that is, and information about it is on the NASHB website. Or Becky. They might be on mute.
This is Paige, Karen. I can also, since I have the language that you all shared about that and the link to register, I'm happy to send that around following the meeting for folks who are registered. So we can do that so folks can have it in that email in one place.
Great. Thank you so much.
Yeah, no problem. Looks like we got another question. So what's the advice or the process to negotiate for care coordination reimbursement or flat fee?
This is Susan. I'd be happy to talk to you more about it. I think part of it was really good timing, and we had support of the Department of Health leadership. They were looking at a contract for the whole department with the MCOs, and it also took a lot of work and education about the type of care coordination that we provide and why it's different than care coordination provided by MCOs, and really kind of the niche that we filled in the special needs community. So there was a number of factors. That's how it worked for us in New Mexico.
Great, thanks so much, Susan. All right, we have time for about one or two more quick questions.
Can I ask a question of Susan and Rachel? This is Karen.
Of course.
I know that, especially for state Title V programs, everyone really varies in terms of their work on this, and I wonder if Rachel and Susan, you could both offer up kind of your lessons learned or best advice for other states that are interested in really trying to maybe work more closely with their partners in Medicaid or work, you know, on Medicaid managed care contracting, you know, kind of what would be your top two pieces of advice for your colleagues in other states?
This is Rachel. I'd say first and foremost, get in touch with your Medicaid agency or Medicaid partners as soon as you possibly can when you know that these changes are coming up. I think you know, we probably you know, could have taken advantage of that more and potentially been involved to a greater degree immediately after this legislation was passed. So definitely do that, and then also be prepared to you know, share specifically, you know, what your strengths are as a Title V program in helping to create a model, a managed care model that will, you know, serve your population. I think, you know, for us, we knew that we had a lot of leverage in the work that we were doing around transition to adulthood and adult health care, and that, you know, was just some low-hanging fruit for us that we knew we could take advantage of in providing that assistance to our Medicaid program.
And this is Susan. I think you can find one friend at Medicaid that you can work with and carry your message. That can be extremely helpful. And also, we sort of presented ourselves as, you know, you have this great challenge of providing care coordination for all these, you know, Medicaid members, and we can help you. You know we can help you be successful. So that was another strategy we used. And also, I just have to thank AMCHIP and NASHB for the Action Learning Collaborative opportunities, because that really helped us pull together a team and focus some of our efforts in our work. And I think that is helping us be successful. So if you have an opportunity to participate in an ALC, I would highly recommend it.
This is Rachel. I absolutely agree. Thanks for mentioning that, Susan. We were able to participate in Action Learning Collaborative early on, and that really helped us form some much-needed partnerships.
Great, thanks everybody. So we just had one more question come in, so I'm going to try to do this one quickly. So while there's interest and support from national Title V organizations to work with our state Medicaid partners, is there the same interest or push on their side?
Maybe Rachel and Susan want to answer from their perspective of their partnerships in states, but I will say kind of from the national perspective and the work we do, I would say absolutely. State Medicaid agencies are very interested in really trying to improve their Medicaid managed care organizations, and they're also really interested in this population of children in particular, not only for all beneficiaries, but especially for kids with special health care needs. So I think we're at a really important time in this country with regard to health care, and as we know, and I think it's a really important time to be, partnering with your Medicaid counterparts. And we have lots of examples of that. So again, I know some work is on AMSHIPs and the Catalyst Center, but also the NASHB websites.
And I would agree. This is Susan.
This is Rachel. Yeah, definitely. I think it's something, a little caveat, and in our work around the standards and in partnering more closely with our Medicaid program through the Action Learning Collaborative, something that we came to realize was that they viewed partnerships in a much different way than we do. So, that's still a work in progress for us, but it hasn't kept us from continuing to, share with one another and learn from one another.
All right. Well, thank you all so much. I want to be mindful of time. It is just 1 minute past the hour. So as I mentioned earlier, we'd really appreciate it if you all would fill out the evaluation that should have just popped up on your screen. This will just really help us because this is a newer topic and, in partnership with NASHB, we're really working on this a lot further with our Learning Collaborative and our Phase 4 work of the national standards. We really appreciate it if you all would let us know if there's anything else you'd like to learn. There's a space on there to let us know, any interest you have in this work. So really appreciate it. And again, I just want to thank all of our presenters and all of the participants for being on the call today. Also like to thank the Lucille Packard Foundation for Children's Health for their support of this work. We really hope you found this to be value added for your work and that you'll share the information with your colleagues. Again, this webinar was recorded, and the link to the recording and the slides and all of the resources we talked about, those will be posted to the AMCHIP website, and I'll also be sending out an email to all of you who are registered for the webinar. So please just make sure you are able to complete that brief evaluation. We really appreciate it, and I hope you all have a great rest of your day.